Morning. This is Dr. Ritika Guha. I'll be teaching you anatomy physiology for this diploma in acupuncture course. First, we'll go through. There are 4 semesters. First is anatomy physiology, health and hygiene, first aid and CPR. And then in the acupuncture subject, history and fundamental of acupuncture. We'll directly see there are some reference books, recommended textbooks through which you can go through. You can download PDFs also. Now in anatomy there are 10 topics which we have to cover, that is general introduction, skeletal and joint system, muscular system, circulatory system, respiratory system, digestive, urinary, endocrine, nervous system and reproductive system. And the definition. Human anatomy is a science which deals with the structure of human body. The term anatomy is derived from the Greek word called anatom, which means cutting. Okay, now anatomical position. All the description of the human body are based on the conventional reference posture termed the anatomical position. Okay, so there are 4 planes which we'll study. First is medial plane, where the body is divided into left and right equal halves. Okay, you can see in the diagram. Then there is the transverse section, where the superior and the inferior part is divided. Okay, and then we'll see sagittal part, when the body is divided into 2 parts, left and right, but unequal. In the median plane it is equal, and in sagittal plane it is unequal. And then there is a frontal plane. In the frontal plane or the coronal plane, if the body is divided from here, the front part and the back part is divided, then it is coronal plane. Okay, then horizontal plane is also known as transverse plane. It lies perpendicular to the long axis of the given structure and divides that structure in the cross section orientation. The term transverse plane and horizontal plane are often used interchangeably. However, they are not necessarily equivalent. Okay. Now, positions and direction. How we'll lay the patient down. Okay. So there are 2, supine and prone. In supine position, a person is laying on his or her back, arms by the side and palms facing upward and feet together. Okay, this is supine position. And in prone position, the person is laying on the chest, abdomen. It is said to be prone position. Okay, so there are 2, supine and prone. Now in acupuncture, this position is frequently used to treat, heal the meridian located at the back. Okay. Now we'll see few more sides, and anterior and posterior. The front part of the body is anterior, and if we are talking about the back part of the body, then it is posterior. If we are talking about the hands, then this part is palmar and this part is dorsal. Same goes with the foot. If we are talking about the sole, then it is plantar, and if we are talking about the posterior part, then it is dorsal. Okay, upper part, it is dorsal. Now medial, nearer to the mid plane is medial. Okay, I'll show you in the diagram. So the yellow one is the midline. Okay, if a rod is passed from here till your foot, then it is known as midline. The things near to the midline is median, and things far away from the midline is lateral. Okay. Then superior. If we are talking upward, like your head, your eyes, then it is superior to the body. And if we are talking about the legs, then it is lower to the body. Legs, nail, whatever. The head is the superior end of the body, and whereas the feet are the inferior end of the body. Okay. Now, proximal and distal. What is proximal? Anything closer to the attachment of the limb. Okay. The joint closer to the attachment of the limb. So we are talking about the joint closer. Okay, I'll show you in the diagram. So this is shoulder, this is elbow, then elbow is the proximal. Then what will be the distal? Distal will be our wrist, as you can see in the diagram. Elbow is proximal and distal is the wrist joint. Further away from the origin point of attachment. Now what is superficial? Towards and closer to the body surface. Okay, and far away from the body surface. If we are talking about our lungs, then it is deep inside. Okay, if we are talking about our skin, then it is superficial. Now in the diagram I am showing you, the red one is your skin, then there is your rib cage and heart. Okay, so here the example is given. The skin is superficial to the ribs, but the heart is deep inside the ribs. Okay, now deep and superficial. Okay, then internal and external. Inside the structure, outside the structure. Lateral, contralateral, on the opposite side from the reference point. Afferent, flow towards the reference point, flow away from the reference point. Okay. Evagination, projection inside, evagination, projection outside. Invagination is inside. Okay. Now, what is joint? When in a site, two or more bones articulate to each other or come to each other and make a joint which is movable, non-movable or slightly movable, it is known as joint. Now, flexion, extension, when the movement in which the joint angle is decreased during the motion. If we bring our hand toward us, then it is flexion, and if we move our hand away from us, then it is straightening. Okay, you can see in this example also. The flexion is usually an anterior movement, but it may be directed posteriorly. As in the case of knee joint, also the flexion typically implies a relatively more powerful anti-gravity movement. Extension of knee, dorsiflexion, all you can see in this diagram. Now what is abduction? Movement away from the midline of the body in the coronal plane. This is abduction. And movement towards is adduction. And what is rotation? And the movement is of a part of the body around its axis. This is rotation. Okay, or this is rotation, you can say. Now medial is the movement that results in anterior surface of the part facing medially. Same with the lateral. Circumduction, where all the movements takes place: flexion, extension, adduction, abduction, rotation. Forearm pronation, turning your forearm medially in such a manner that the palm of the hand faces posteriorly. Okay, this is pronation, this is supination. Okay, this is pronation, this is supination. Same with the leg, you can